Hello, everybody. Welcome back to my channel. I haven't been here maybe for about 3 or 4 weeks. I've been busy getting things together for my CRC course that's starting next Saturday, which is August the 13th through October 22nd. We have a few tickets left, or a few enrollments that can be filled. If you want to sign up for that, I will put the link in the bio. The CRC course is for 11 weeks. And I'll also leave the number where you can reach me if you have any questions. So today I want to talk about a subject that a lot of people have been asking, calling me, emailing me about. And as I've gotten into HCC coding, of course, over the last 3-4 years, I've noticed that, sometimes this is intricate information that you would need to know about this specific chronic condition. Today, we're going to talk about pressure ulcers. We're going to talk about ulcers today, pressure. Now, you do know there is a difference between non-pressure ulcer and a pressure ulcer. Pressure ulcers, or more so like bed sores, because your skin is pressured maybe by the bed. You're laying there, you're not getting turned. So it's going to turn to a sore or a wound, and then eventually an ulcer, because of the pressure that you're having on your skin. So there are non-pressure ulcers as well, where you can get ulcers. Just for an example, diabetic patients. There's a combination code for diabetic ulcers, diabetic foot ulcers, or diabetic ulcers, period. Because diabetes is one of those diseases that affects a lot of your organs, your heart, your skin. It affects your kidneys, so many things. So pressure ulcers are also prevalent with diabetes as well. So you have non-pressure ulcers. Let me get it right. Non-pressure ulcers are real prevalent with diabetes, non-pressure. Pressure ulcers typically are known as bed sores because there's pressure on your skin. So have a lot of notes here that we're going to talk about in regards to ulcers, pressure ulcers. So number one, I want you to know the section that you're going to look. If you have any questions in regards to coding ulcers, diagnosis coding. Now, we're not talking about CPT coding with any procedures. We're not talking about HCC codes. We're talking about diagnosis coding for ulcers. And if you're an HCC coder or interested in becoming an HCC coder, pressure ulcers is a very common chronic condition among their population. So if you're wondering all the rules, the guidelines in regards to ulcers, you're going to look in your diagnosis coding book, your ICD10CM book. ICD10CM book. And you're going to look section I, C, 12, A, and number 1. That's exactly where you're going to look for the guidelines in your book. So, pressure ulcers can be simple or they can be complex, and they are both at risk for infection, whether they're simple or whether they're complex. So ulcers are also described by their size, their location, the severity, and the type. Remember that. So let's talk about inpatient admissions and pressure ulcers. If someone is admitted to the hospital and they have ulcers. So if a patient is admitted with a pressure ulcer that's evolving into another stage during their admission, let's talk about how to code that. Because sometimes they can be confusing if you do not know your guidelines and if you do not know your rules. So if a patient, let's say a patient was admitted at a stage 1 and it progresses to a stage 2, separate codes should be assigned. You're going to code one code for the site and stage of the ulcer upon admission when they first got to the hospital. And then you're going to code a second code for the same ulcer site and the highest stage reported during their stay. You get that? If they was admitted at one stage, and then as they were there for the hospital visit for maybe a couple of days, a week, it progressed to a different stage. The ulcer progressed. So sometimes people wonder, do I code 1? Do I code 2? Do I code one or the other? You're going to use 2 codes. You're going to use the code for the stage that the ulcer was in when they first got admitted to the hospital. And then whatever stage it's in when they're being discharged, you're going to record that stage as well. Okay, so let's say that the patient came in and it healed. Let's say if the ulcer was present upon admission, but healed at the time of discharge. What you're going to do is you're going to assign the code for the site and the stage that it was upon admission. If the patient comes into the patient comes into the hospital with a pressure ulcer, it heals during their admission, then you're going to code the ulcer for the site, the type, the severity. You're going to code that ulcer exactly what it was when that patient was admitted to the hospital. So all pressure ulcer codes, come from L as in Lima, L89. Understand that when you code all pressure ulcer codes, it requires 6 characters. ICD10 equates pressure ulcers to like bed sores, decubitus ulcers, pressure area, or pressure sores. Now, if a person has gangrene as a result of the ulcers, you're going to code the gangrene first. Code the gangrene first. Code first. Pay attention to your instructional notes. Those red notes, if you're looking at your ICD10CM book. Now, Optum book, it doesn't have the red notes, instructional notes. Some people use Optum book. Some people use the AAPC book. I love the AAPC book personally because I've just been using it for the last 7 years or whatever. So I just love that version. And since, again, I was taking the AAPC exams, I wanted to buy their book. So that's how I started using the AAPC book versus Optum. But I have used Optum books at jobs before. Same information, just differently formatted how the book is. So make sure you pay attention to your red instructional notes if you have your AAPC ICD10CM book. So code the gangrene first. If a person has gangrene as a result of ulcers and stuff like that, code the gangrene first. I keep saying that because that's going to be on the risk adjustment exam, and it's very important to know if you're going to code ulcers properly. So let's say, okay, remember this. Oh, I wrote this down so you can remember this. So the 4th character identifies where the ulcer is located. Remember this. You know we have characters in our codes. So remember the 4th character in ulcer codes. Remember we said it requires 6 codes. So remember the 4th character identifies where the ulcer is located. The 5th character identifies the laterality, if it's left or right. If you hear laterality, that's left or right. Again, 4th character represents where the ulcer is located. 5th character, laterality. And the last character, which is 6, it describes the stage of the ulcer. So let's give you an example. So if you have your books in front of you, because I know when I was looking at YouTube videos and things like that, I would have my books in front of me so I can flip to what the person on YouTube is talking about if I did. You know, it wasn't a lot of videos back then, but it was enough. So I would definitely have my book when I'm studying. So look up the code. L89.144. L89.144. And that's for pressure ulcer of the left lower back. And that's stage 4. Remember, I just said the 6th character lets you know the stage. So L89.144, the last character is a 4. That lets you know that it's a stage 4 ulcer. So If it's a 0 at the end of the 6 characters, if the 6th character is a 0, that means that ulcer is unstageable. It's unstageable. So if they have a 1 at the end, stage 1. 2, stage 2. 3, stage 3. 4, stage 4. Then there's a 6. 6 stands for, there's a 6 on the end of that ulcer code, pressure ulcer code that's coming from L89. That means deep tissue damage. Deep tissue damage, if it's a 6 on the end. If it's a 9, that means unspecified. If anybody has taken my course before of taking a workshop for me, it's a little, a little hack I always talk about. Now, it's not 100% of the codes, but primarily most of the codes. If it is a .9 code, then more than likely that code is unspecified. Let me give you an example. I50.9, that's heart failure unspecified. Heart failure unspecified. Another code with .9, G62.9. Polyneuropathy unspecified, or neuropathy unspecified. So most of your .9 codes going to be your unspecified codes. So understand that there is a difference between unstageable and unspecified. Unstageable and unspecified. Unstageable means we just can't determine the stage. It's unstageable. The ulcer is unstageable. Unspecified means they just did not specify the stage in the chart. You have to pay attention to the documentation and the language to know the difference between unstageable and unspecified. Also looked it up. Man, allow Google and YouTube University to be your best friends when you're trying to find out information. And even when you're taking a course, don't solely rely on the instructors. Of course, the instructors are going to give you all of the information that you need to know, but also take it upon yourself to look up some things on your own. If it's something you're not sure about, of course, ask a question. And even if you, or when you ask the questions, always take time to double check or look up things, or let me get this in more detail, or things like that. So thank you so much for joining me today as we talked about pressure ulcers coming from L89 category. Thank you so much. I'll be making a lot of more videos to make up for me being gone, getting this course together for my upcoming enrolled students for the August the 13th through the October the 22nd CRC course. Like I said, I will drop the link in the bio if you want to sign up for that course. So thank you so much, and you have a great day.